Hello, nephew community, and welcome to today's presentation, Mental Health in Autosomal Dominant Polycystic Kidney Disease, also known as ADPKD. My name is Dr. Marla Dalal, and I'm a medical science liaison at Otsuka Pharmaceuticals.
My name is Dr. Jamini Patel, and I am also a medical science liaison at Otsuka Pharmaceuticals. Marla and I will be serving as your moderators for today's program. With us is Dr. Rebecca Adut and Hannah Graves, our featured presenters.
But one of the things that we don't think about is the psychological impact and the burden of this disease on our patients. Hannah, we know you're very well versed in this space. Would you be able to comment on the psychological burden and what our patients may be experiencing?
Absolutely. Thank you so much for asking and pointing that out. Oftentimes, patients living with chronic illness have challenges navigating the world because of this heavy burden of feeling very different from their peers, feeling very sad, overwhelmed, scared of the future, and have difficulty processing just day-to-day tasks. So going along with that, anxiety, depression, and consideration of quality of life is that ADPKD can significantly impair quality of life and psychosocial well-being, where we see in a decrease of quality of life with an increase of psychosocial burden, where the psychological effects of living with the diagnosis have actually shown to have a decrease in life expectancy, where we see as renal insufficiency progresses and quality of life decreases, an increase in the level of anxiety and depressive complaints can be found in patients. Even early in the course of the disease, ADPKD patients report a lower satisfaction with life compared to healthy individuals. Early presentation of anxiety and depression is a predictor of higher mortality rates and later disease stages. So it's really important to detect and manage psychosocial difficulties early to improve quality in life as part of medical management. So the emotional burden of ADPKD can really compound upon itself in a kind of a cyclical fashion, as is shown here. The depression is one of the most common psychological disorders associated with chronic kidney disease and may be caused by a sense of a loss of autonomy. Genetic testing may confirm the diagnosis, but may also have negative implications for patients, such as restricting access to insurance. Patients may feel anxiety and distress while on the waiting list for kidney transplant. Fear of organ rejection by patients may also increase patient anxiety and distress. Worry and fear associated with pain, unpredictability of symptoms, the effect the disease on work, finances, the future need for dialysis or transplant, or the diagnosis of an intracranial aneurysm. Confusion may be linked to a lack of adequate patient education, and generational guilt may be due to worrying about transmitting the disease to the next generation. Dr. Adut, can you talk next on patient and physician perspectives on ADPKD, please?
Unfortunately, there's a disconnect between physician perceived versus patient reported symptom burden. A cross-sectional study of 300 ADPKD patients and 155 nephrologists in the US evaluated the perception of ADPKD symptom burden from the patient reported perspective as compared to the physician perceived burden across a series of CKD related symptoms. Early stage patients reported greater severity of fatigue, whereas the physician perceived patient symptom burden of pain, hypertension, cardiovascular problems, and liver cysts. Late stage patients reported a greater burden of fatigue and skeletal pain compared to the physician perceived patient symptom burden of urinary frequency, hypertension, liver cysts, and hematuria.